Myanmar and welcome to MI Radio's Myanmar Today. I'm Henry Zin. We've got the latest news and reports. Questions on conserving buildings at the dockyard raised at Amyotha Hluttaw. While other parts of the world see a rise in coronavirus cases, the epicenter Wuhan sees gradual recovery. In a state of panic over the global pandemic, State Councillor Aung encourages citizens not to panic in the fight against COVID-19. And a story on the third inauguration ceremony of Jaipur Food and Unnu Foundation. All of that on this edition of Myanmar Today, but now let's take a look at what's happening in local news. State Councillor Aung, who's also the chairperson of the National Level Central Committee on Prevention, Control and Treatment of Coronavirus Disease, delivered a speech on control measures of the disease on Wednesday. The meeting held at the Presidential Palace in Naypyidaw was attended by union ministers, chief ministers and ministers of region or state governments and officials. The officials discussed 3 COVID-19 cases in Myanmar, treatments given to them, containment of the disease to those who had close contacts with them, and the places they visited, transportation arrangements for migrant returnees from Thailand to their homes, accommodation for them before they arrive back to respective destinations, community-based facility quarantine for them, and other measures against COVID-19. State Councillor Aung gave guidance and decisions based on matters presented at the meeting. The Ministry of Health and Sports is conducting surveillance for COVID-19 at international entry or exit gates in hospitals, communities, and in collaboration with private hospitals. There are 38 new patients under surveillance between Tuesday and Wednesday. A total of 59 patients are under hospital quarantines as of 8 p.m. on Wednesday, and the results of their lab tests will be made public in real time. 2 family members who have been in close contact with the 26-year-old male in Insein Township, Yangon region, who tested positive for COVID-19 have been quarantined in the hospital. The other 9 people who have been in close contact are quarantined in their homes. The patient who tested positive was on the UB701 flight from Bangkok to Yangon on 21st of March and was seated in aisle 3. Passengers who were in aisle 1 to 6 are strongly advised to contact their nearest health departments and self-quarantine themselves in their homes. The ministry strongly urges people who have returned from countries with COVID-19 cases to restrict themselves to their homes and adhere to the health guidelines issued by the MOHS. Currently, 195 countries are infected with COVID-19 and the public is urged to adhere to the health guidelines issued by the Ministry of Health and Sports. Chin State government has instructed the locals to stay at homes in Ketao village of Tidim Township, Chin State, where the COVID-19 case was found. Uso Tet, the Minister for Development, Electricity and Industry of Chin State government, said the case happened some days ago and the patient's wedding is also over. Locals in the entire Chin State have been alerted to the risks of the disease, and the Chin State government held an emergency meeting on control measures of this disease. He said the infected person is getting medical treatment at the hospital in Tidim Township. He has no more fever at present and is in good health. His specimen was tested positive while he was ill. The minister also said they are monitoring all the places he visited. The union government has sent a team to Chin State on Tuesday to help the local government in this case. Public events have been banned in the entire state, and the restrictions will also affect going to churches on Sunday. Chin State government has contributed 50 million kyats for the COVID-19 control fund to the public donation of 30 million kyats. The fund will be used for medicines and other needs. The Sri Lankan Pagoda reduced its opening hours to 7 as part of precautionary measures against the COVID-19, according to the Pagoda's Board of Trustees. The pagoda will be opened from 9 a.m. to 4 p.m. daily, starting Wednesday. The number of people taking elevators was also limited at the pagoda. Officials are checking the body temperature of individuals who visited the pagoda, donating masks and providing hand gels, and washing basins were also set up at the pagoda. The pagoda is normally open to the public about 18 hours daily from 4 a.m. to 10 p.m. That's all with the local news. Let's take a look at the first report now on Myanmar Today. At the second Amyotha Hluttaw's 15th regular session, Hluttaw Representative Wucho Tway of the Yangon Region Constituency 8 raised a question concerning the plans to conserve the buildings at the historic and ancient dockyard and to open the Museum of Myanmar Water Transport. Wu Tau Deputy Minister for Transport and Communications responded to the question.
Second, Amyotha Hluttaw continued to hold the 13th day of its 15th regular session on Wednesday. In the asterisk-marked question and answer session, Hluttaw, Representative Wuhan Tui of Yangon Region Constituency 8, raised a question concerning the plans to conserve the buildings at the historic and ancient Dalat dockyard by regarding as ancient heritage, and to conserve the whole Dalat dockyard, to open it as a museum or to implement the projects for the benefits of the local. Dalat dockyard is located in the opposite of Bansoran Jetty on the bank of Yangon River, and it has an area of 30 acres. After declaring the independence of Myanmar in January of 1948, Dalat dockyard was owned by the state to do ship construction and repair.
Out
of 6 state-owned dockyards, Dalat dockyard is the biggest and the most ancient dockyard. It is 168 years old, and some buildings are still in the original status. So, if we regard it as an ancient heritage, it will be a pride for Dalat residents as well as for Yangon. Moreover, if it is possible to construct the Museum of Myanmar Water Transport and Training School for Ship Construction, it will create an extra opportunity for engineers and youths who are seeking for a professional career. It takes about 10 minutes from Yangon to Dalat through waterway, and after the construction of Dalat Bridge, the transportation will be a lot faster. So we need to utilize the dockyard as the attraction point for the visitors.
For the question raised, the Deputy Minister for Transport and Communications, Wuhan responded that
according to the protection and preservation of ancient buildings law, more than 100 years old Myanmar cultural buildings are regarded as antique buildings and are being protected. According to Section 4 of the law, shipyards are excluded in buildings which can be defined as heritage. Thus, the last shipyard cannot be yet regarded as heritage, and we have no plans for it.
The Ministry of Culture and Tourism is implementing to introduce the new tourist destinations. So, it is also going to maintain the Dalat dockyard and construct the Historical Museum of Myanmar Water Transport to attract the foreign tourists. To set it as the new tourist destination, the ministry is working together with Yangon Region Tourism Committee.
It is the main dockyard where the construction and repair of the ships of inland water transport, as well as for the private companies, are being done. Although it is an antique, most of the buildings at the shipyard are maintained and refurbished in line with the needs of the technology. The only building which is now used to store old equipment is left in original status. It is going to conserve as a historical waterway transport museum, and a blue plaque is to be installed. Yangon Heritage Trust is also doing field studies.
According to Deputy Minister, the Ministry of Transport and Communications has sent the project proposal on the advanced plans for the Dalat dockyard to get support from Japanese government through Japan International Cooperation Agency JICA in September of 2017. The process of making for financial aid from Japan is succeeding, so Japan-based SA Marine Myanmar Company Limited and China Civil Engineering Construction Corporation (CCECC) are together carrying out the development projects for the Dalat dockyard and surrounding areas. That's all for now. This is Dora Swinson from MI Radio.
That's a report on a question on conserving buildings at Dalat dockyard raised at Amyotha Hluttaw. All right, we'll carry on with the next report here on Myanmar Today. The epicenter of the coronavirus outbreak, Wuhan, sees gradual recovery over the past several days. No new cases were reported for 4 consecutive days until Monday, and only 1 new case was reported. However, confirmed cases across the globe are on the rise. MI Radio reached out to Huang Yue, a CRI reporter in Wuhan, to probe further updates of the status quo at the epicenter.
China has slowly recovered from the deadly pandemic COVID-19 with no new cases over the past several days. With Wuhan reporting one new COVID-19 case on Monday, the outbreak epicenter is slowly recovering. On the other hand, the world is struggling with confirmed cases now exceeding 330,000 globally. MI Radio reached out to Ms. Huang Yue, CRI reporter in Wuhan, to probe further updates of the status quo at the epicenter.
As of Monday midnight, there were 4,200 patients hospitalized in Wuhan, including over 1,500 critically ill patients. 426 patients have been cured and discharged from hospitals on Monday. 7 new deaths were reported, and the death toll in Wuhan was 2,524 as of Monday. 50 hospitals with over 19,000 beds in Wuhan have been reopened to treat non-COVID-19 patients. Another 11 hospitals are under disinfection, preparing to receive non-COVID-19 patients. 14 more medical teams with nearly 1,500 medics have left Wuhan to go back to their home provinces. There were still 180 medical teams with over 23,000 medics working in Wuhan. After 5 days of 0 new cases, Wuhan reported 1 new COVID-19 case on Monday. The new confirmed patient is a doctor of Hubei General Hospital and has been working in the hospital recently, so experts say they don't rule out the possibility of hospital-acquired infection.
Experts have attributed the outbreak to a novel coronavirus that has since spread across China and abroad, with confirmed cases as of 24th March exceeding 330,000 globally. As of 24th March data, China has reported 81,747 confirmed cases, with over 3,000 deaths and over 73,000 recovery cases. After 5 days of 0 new cases, central China's Hubei province reported 1 new COVID-19 case on Monday. Wuhan will lift outbound travel restrictions starting 8th April after over 2 months on lockdown. 2020 Tokyo Olympics will be postponed by 1 year because of the coronavirus. Huang Yue continued to explain the requirements the passengers need to travel.
Wuhan announced that it will open travel to outside the city on April the 8th, and other parts of the whole province will end their lockdown on Wednesday. People will need to show a health code, which is a digital health certificate issued by Hubei province, when they leave. Starting on Wednesday, migrant workers in Wuhan who hold a green health code and wish to return to work outside the city could be transported in groups directly to their destinations after passing a nucleic acid test for novel coronavirus. Other travelers with a green health code will be able to leave the city on April the 8th. People from other provinces will be able to travel within Hubei with a health code issued by their original provincial regions without the need to present other certificates. Wuhan will gradually resume production based on epidemic risk evaluation. The opening time of school, including colleges, kindergartens, and vocational institutions, is still postponed and will be set at a later time.
Shanghai is set to halt international flights at Hongqiao Airport after Wednesday. Starting from Wednesday midnight, according to the Shanghai Municipal Authority, Shanghai Hongqiao International Airport will halt all internationals, Hong Kong, Macau, inbound and outbound flights. Flights scheduled prior to the deadline will be moved to Pudong Airport, but Hongqiao Airport will remain operational for backup landings. The decision was made to focus efforts on preventing the imported coronavirus cases, as Shanghai now stands at one of the hotspots of the imported cases in China. This is Agajo reporting for Myanmar International Radio.
That's somewhat of good news on the epicenter of the coronavirus outbreak, Wuhan, seeing gradual recovery. All right, let's have a look at the currency rates now from Myanmar's central bank and the stock exchange. $1 is at 1,389 jats. 1 Chinese renminbi is at 195 jats. 1 euro is at 1,504 jats. 1 pound sterling is at 1,656 jats. 1 Singapore dollar is at 960 jats. 1 Malaysian ringgit is at 316 jats. 1 Thai baht is at 42 jats, and the Indian rupee is at 18 jats. Gold is trading at $1,606. Silver is at $14. And Brent crude oil is at $24. On the Yangon Stock Exchange, FMI is at 10,000. MTSH dropped 50 and it's at 3,500. MCB is at 8,200. FPB is at 21,500. TMH is at 2,750. Stay with us as we bring you more reports on Myanmar Today. After the confirmation of positive cases of coronavirus infection in Myanmar, State Councillor Aung San Suu Kyi delivered a message to all Myanmar citizens not to get into a panic, but to remain calm and follow the advice of the health authorities on COVID-19. She mentioned that there is no plan to shut down necessary public services, markets or commodity centers, and there is no likelihood of running out of stock. DJ Henry Zin will tell us more.
The Ministry of Health and Sports in Myanmar on 23rd March announced 2 positive cases of coronavirus infection within the country. This is the first 2 cases found in Myanmar since the beginning of the outbreak of COVID-19 in the world. On 25th March, 1 more case was confirmed to be tested positive for COVID-19, bringing the total number to 3. The 2 persons who had returned from the UK are in Yangon, and another one who had returned from the United States is in Chin State. Being informed of positive cases, the citizens of Myanmar are afraid of the pandemic, and at such a time, State Councillor Aung San Suu Kyi, in her capacity as the chairperson of the National Level Central Committee on Prevention, Control and Treatment of COVID-19, delivered the message to the citizens not to get into a panic, but to remain calm and follow the advice of the health authorities on COVID-19.
COVID-19 ကူးစက်ခံရသူ2ဦးတွေ့တယ်လို့သတင်းထွက်လာတာနဲ့တပြိုင်နက်
As soon as the news that 2 persons have been found to have been infected with COVID-19 came out, some people began buying foods, medicines, and household items in panic. There is no likelihood that we will run out of stock. If you go into the crowd to buy these commodities, there is more likelihood that you will get the disease. People are the key to prevent the spread of this virus. The ability of the people to remain calm plays a pivotal role. I want to inform that the government has no plan to shut down necessary public services, markets, or commodity centers. It is also advised that only 1 person should go for buying instead of going in groups. Fake news is floating around that enterprises, factories, workshops will be closed and that entry and exit points to townships and villages will be closed. Please do not panic by such news.
Myanmar is welcoming back the nationals working in Thailand as well as the students studying abroad. They are advised to stay at home or a designated place in a responsible manner for home or facility quarantine for 14 days to prevent the spread of the disease. Just as in the saying, report early, know early benefits everyone, State Councillor urged the citizens to report to health centers for any necessary cases. Community-based volunteers are also helping in any way they can. Public awareness raising programs, placing the basins at the crowded bus stops to wash hands, spraying the pesticides at the markets are being carried out. Yangon Rescue's organization is also participating in social activities in a bid to prevent COVID-19.
We clean the conventional markets by spraying pesticides. We are distributing the awareness brochure to the public. We are to raise public awareness program for the people not to be panicky and to prevent the infection by staying at home if possible. If you have to go out, please follow the health guideline. Keep your hands clean.
For the people who are worried about the shortage of the commodities and the increase of price, the government has also claimed to take responsibility to control these situations.
Rice and oil are locally produced, so there is no reason for the shortage. Moreover, goods are already stored at the wholesale sheds. For all the goods we have in hand, we sell with regular price. There is no increase of price in rice and oil. The State Councillor mentioned that people are the key when preventing and fighting against the pandemic.
Based on responsibility, accountability, and transparency, which are the basic fundamental needs of good governance, our government will raise up-to-date information in real time, all information that the people need to know. People are the key.
That's all for now. This is Dora Swisin from MI Radio.
That's a report on State Councillor Aung San Suu Kyi encouraging citizens not to panic in the fight against COVID-19. A cooperative humanitarian project is providing artificial limbs to about 300 disabled persons from Myanmar. The program was established by the Jaipur Food Artificial Limb Fitment and the Unu Domyayi Foundation with the support of the Ministry of External Affairs of India. Pyo Tiritu has more.
According to 2014 census, 4.6% of its population living with some form of disability. More than a quarter of these populations with disability have multiple disabilities. This level of disability is relatively low compared with other countries in the region. But calculating at the household level, there are more than 1.7 million households, or nearly 16%, if conventional households with at least 1% living with a disability. Disability prevalence from 2014 census shows that walking difficulty is the second common sort of disability. A cooperative humanitarian project is providing with artificial limbs to about 300 disabled persons from Myanmar. The program was established by the Jaipur Food Artificial Limb Fitment and the Unu Domyayi Foundation with the support of Ministry of External Affairs of India. The third edition of inaugural ceremony was launched on Saturday at the Pirigatombong Nikaya Monastery, South Dagon in Yangon. The ceremony was attended by a number of distinguished guests, including the Ambassador of India to Myanmar, the Minister of Planning and Finance of Yangon Region Government, the Director General of Medical Research under the Ministry of Health and Sports, the Chairperson of Unu Domyayi Foundation, the donors, and the responsible persons. His Excellency Sarab Kumar, the Ambassador of Embassy of India in Myanmar, said,
Cooperation in this humanitarian area is also very important. We have been doing several camps. Over 1,000 artificial limbs have been fitted on people who needed it, and our feedback is that those who have received the Jaipur food have benefited a lot from it. So this is an important part of our cooperation, and the objective of doing it is to take the benefits of Jaipur food to the people of Myanmar.
The Jaipur Food and Unu Domyayi Foundation have organized this program since 3 years ago. Over 330 disabled people for the first edition and over 500 disabled people for the second edition of this program received artificial limbs. This year, for the third edition, about 300 disabled people received the artificial limbs. According to Chairperson of Unu Domyayi Foundation, Dr. Tanu, the patients came from all various regions and states of Myanmar, including Yangon, Ayeyarwady, Bago, Magui, Kayin, Kaya, Shan, Kachin, and Rakhine. Dr. Tanu, Chairperson of Unu Domyayi Foundation, said,
The foundation was founded in 2015. Since then, our foundation is helping the difficulties of the local community in aspect of health, education, and social affairs as much as we can. The foundation was permitted to provide the artificial limbs to the disabled with the support of Jaipur Food since 3 years ago. Within the 3 editions of this program, over 1,000 disabled people have received the artificial limbs. The program has no exception for the disabled patients in any region and any races. We will carry on the program every year, especially to come more children patients to the camp.
BNVSS, which is the technical and implementing partners of the Jaipur Food, has served more than 1.85 million people with disabilities in India and around the world. It has sent the required materials for the camp in Yangon together with a 7-member technical team. Mr. Hluttaw Hluttaw, city officer of BNVSS, said,
"We are 7 here. So all of expert for this making processes. This is a course of processing and orthotics expert. They are more experienced, around 20 years, 30 years, 35 years experience. We are also trying for here some local people trying for train for here also, because our trustee is interested, Mr. D.R. Mehta. So we want to establish a workshop, permanent workshop here, because it's very easy technology."
U Tin Sen, who is a patient of Jaipur Food, said,
"I lost my leg since 2015. 4 months after my loss, I have started using the artificial limb. Last time I used the Soccer Fit limb, but in here they use the Rapid Fit limb. For me, it is first time using this, but this Rapid Fit limb is really light and durable, and here are really quick. They just do one time for a measurement, then get the fit limb for me within a day."
I am Jyoti Ritu. This is news reporting from MI Radio.
And that's all we have for today's reports. And it's probably time to check on some international news here on Myanmar Today. Chinese doctors who served on the front line in fighting against COVID-19 in Wuhan, the epicenter of the novel coronavirus, share their experiences of using traditional Chinese medicine with experts from India, Pakistan, Canada, and the UK via conference call. COVID-19 Frontline is an online live show for medical workers in China and from around the world to share their experience in dealing with the coronavirus pandemic. Participants will answer questions from social media users in real time. Meanwhile, the World Health Organization says the United States could become the new epicenter of the coronavirus. The country is reporting more than 53,000 cases and counting, a day after the death toll jumped by more than 100 in a single day. Despite the staggering numbers, President Trump wants the U.S. opened up in just a few weeks by Easter.
"You cannot buy them. You cannot find them. Every state is trying to get them. Other countries are trying to get them. The capacity is limited. They're technical pieces of equipment. They're not manufactured in 2 days or 4 days or 7 days or 10 days. So this is a critical and desperate need for ventilators."
Our country is not supposed to be, it's not built to shut down. Our people are full of vim and vigor and energy. They don't want to be locked into a house or an apartment or some space. It's not for our country. We're not built that way.
As the number of COVID-19 cases continues to rise across the globe, the head of the World Health Organization has said that China's control measures could be adopted by other countries as well. This is what the Director General of WHO, Dr. Tedros Adhanom Ghebreyesus, said.
As soon as this outbreak started, China was able to identify the pathogen quickly and sequenced it and shared the sequence with the rest of the world. And the rest of the world had the sequence to prepare for testing, diagnostics, and other things. We were saying to the rest of the world there is a window of opportunity. China is taking massive action, so use this window of opportunity. And if any case comes to your country, contain it as soon as possible. So what we saw in terms of experience from China is really impressive. And as you know now, the outbreak in China is on the decline, and there is a significant decline. The virus is hammered and on a retreat. We are very glad that it's reversing, or the virus is retreating. And this is because of the government's leadership and at the same time the cooperation of the people of China. When any country does that, they can control this outbreak or this virus. This is a common enemy, and I know many countries have differences, But when a common enemy comes, I think we have to focus on the common enemy rather than focus on our differences. This is a time when we need to come together to protect ourselves, to protect humanity.
And that's all we have for today. Thanks for joining me on Myanmar Today. I'm Henry Zin. Have a great day, everyone. Remember to wash your hands correctly and frequently. Practice good hygiene and always be on high alert for important news. I'll see you again. Goodbye.